Henry Ford Orthopedic Sports Medicine physician, Dr. Steven Spadafore. Good morning.
Good morning.
Good to see you.
Good to see you too. Thanks for having me.
Of course, it's
Good to be here.
it's playoff football time, so we've still got some of your athletes competing around the county.
Absolutely. It's the first week of the playoffs. We have 7 of our teams are in there. So Jay High, Western, Lumen, Homer, Grass Lake, Napoleon, and Mason are all in there. So I want to encourage everybody to go out and support our teams and see how far they can make it, if they can make a run. So
When you have both of your teams playing each other, does that cause you any issues?
Not me personally. I'm just out there hoping there are no injuries, honestly.
Yeah, of course.
So.
How's it been this year? What have we seen across the gridiron?
Well, I mean, like I said, we have 7 teams. 7 of our 13 teams, I believe, are in the playoffs. So that's really good. And Lumen's looking strong as always. Mason's looking strong. So a lot of our teams, are poised to make a run. So
cool.
Yeah, we've had a couple of really bad injuries this football season. So it's nice to know there's actually docs on the sidelines at some of these games.
That is good stuff, yeah, for sure. So we're going to talk about some treatment, some interesting things. Platelet-rich plasma. Talk to me about that. What is that?
Yeah, so platelet-rich plasma, or we call it PRP for short, is a treatment that we offer in the clinic at Henry Ford, which is an injection which can help treat injuries, can treat chronic pain from arthritis, and some chronic tendon pain issues as well. PRP is a product that's derived from a patient's own blood. So the way it usually works is that they'll come into the office and we'll draw their blood. We'll process that blood in a centrifuge, which basically spins the blood and separates it into layers or different components. It separates out kind of red blood cells and white blood cells. And what PRP is the liquid part of blood called plasma. And in that plasma it contains platelets, which are rich in growth factors. And then we inject that into the area of injury, or in the case of arthritis, into a joint. And then that helps promote healing, helps promote pain relief and restore function for a lot of our patients.
What causes all that pain and stress in our tendons?
Yeah, I mean, so it can oftentimes start from an acute injury. So PRP is generally good for acute injuries. So if you've done something quickly and maybe strained a tendon or partially torn a tendon, then PRP can help heal that. And then other times tendon pain can come from just overuse. So a lot of manual laborers, people that work with their hands, will get overuse injuries in the tendons, they'll get inflammation. And then over time that inflammation can stay in the tendon, and it can actually be degenerative, and the tendon can sort of break down a little bit. And so PRP and actually 10X, another procedure we provide, can help heal that and help get our patients back on track.
You know what a common injury for a dad is? I'll explain this to you. You show up at a football field or a baseball field. Next thing you know, you have a football or a baseball in your hand. You haven't thrown one in 5 years, and you try and throw it as hard as you can, as far as you can.
Me?
No, well, not. I mean, I've done this. What is that feeling in your arm when that happens? You know what I'm talking about.
I mean, it could, it's probably a tendon strain, to be honest with you. But yeah, certainly that's where you want to warm up and. But I'm learning too as I get older that I'm not as young as I used to be, and these injuries happen easier and easier. So
now there's some treatments. You talked about 10X. What are some? Not everyone wants to go under the knife. Not everyone wants to have surgery. Are there some options away from surgery?
Absolutely. So both of these are kind of great non-surgical options. With these injuries and with these, chronic pain issues with arthritis and those sort of things, we always want to incorporate the usual conservative things, whether it's physical therapy, certain anti-inflammatory medications, braces, and those sorts of things. And if those aren't helpful, that's kind of when we sort of reach more for the PRP and the 10X. And they're kind of an intermediate between these, initial conservative things that we do and surgery. So they're a really good option for patients that are either hoping to avoid surgery or maybe hoping to delay surgery and that sort of thing.
So is tennis elbow, is that tendon
Yes.
issue?
Yep. So tennis elbow on the outside of your elbow is usually a chronic sort of degenerative tendon issue. It comes from overuse. Again, we initially treat that with PT and stuff like that, but both of these options are actually really helpful for tennis elbow. We do them in the clinic. We do them under ultrasound guidance. So the ultrasound helps us kind of visualize the tissue or visualize the tendon. And then, for example, with PRP, we can go directly into the site of injury and deliver the product and have a really targeted therapy.
Have you had that? Tennis?
I have.
It's the funny bone. Do you use the words funny bone?
That's
in your
actually
practice?
not the funny bone.
Only on
is it?
TV do we use funny bone.
Yeah. No,
It's
It's,
not the
uh,
funny bone?
I don't think that is the
What
funny
is the
bone.
funny
Isn't that
bone?
the
Funny
inside?
bone is named the funny bone because it's the humerus. So,
Oh.
right? So,
Okay.
I never
so
knew that.
Really?
Yeah.
it's the tendon on the outside of the elbow.
What are the treatments? Are they like a one and done injection? Is it a series of injections? Does it depend on the patient?
Good question. So that's actually kind of an evolving area of research. Frequently, it will be one injection and kind of see how things go. But PRP is a relatively new procedure. I mean, it's been around since actually started in the 70s. Kind of became popular in the early 2000s when Kobe Bryant actually had it done for his knee. He had to go to Germany to get it done at that time. Now it's much more common. We're excited to offer it at Henry Ford to our patients. But yeah, it's a good procedure.
Very cool. Interesting.
So patients have gone for years to an orthopedic doctor or sports medicine physician to get injections for something happening in their hip or their knee. That's something different. The injections that you're doing with PRP and 10X, that is the next advance?
Absolutely. So we've used steroid injections for a while. For arthritis, we use something called hyaluronic acid injections or gel injections. But PRP has actually been shown to have better long-term effects, as does 10X. So those injections tend to last for a handful of months and are really helpful for some patients. PRP actually has been shown to be more beneficial for a lot of these issues at 6 months and 12 months time. It's not as fast acting, but it is kind of more of, you hope, a long-term solution than some of these other injections and stuff like that.
Is there some sort of recovery period after the 10X?
Absolutely. So for 10X, you know, we usually will have people take it easy for a while. We'll put them on some kind of weightlifting restriction or restrict their activity. And then post-procedurally, we'll incorporate physical therapy as well.
Wow.
So we get them going with physical therapy, strengthen the tendon or the joint back up. And usually for 10X, it's about 6-8 weeks when they start to turn the corner and get back to doing all their usual activity. Similar sort of timeline for PRP as well.
That's cool.
I think a lot of people, they don't know. Is it is it a nerve? Is it a tendon? Is it a bone?
People just assume and then they go with it.
Yeah.
Yeah.
We don't have to know because you will
us.
be
Absolutely.
diagnosing it.
Absolutely. And that's part of it too, you know, it's with these procedures, it's individualized per patient. So we want to make sure that we're treating the right thing with the right treatment and make sure that it's going to be effective for them.
Awesome. Well, thanks for coming in today, and thanks for all you do in our community.
Thanks so much. Yep, we're as I said, we're happy to offer these at Henry Ford Sports Medicine Orthopedics in Jackson, 1201 East Michigan. Happy to see anybody who's interested in hearing more about them.
Awesome. Thanks for being here. Dr. Stephen Spadafore from Henry Ford. More of the morning show right after this quick break.